considered highly traditional. What could be more traditional than a breastfeeding mother? Yet in the 1960s, when this organization was gathering its strength, its activities were quite radical. At this time, doctors were actively encouraging women to bottle feed. By resisting the advice of physicians, La Leche leaders appeared to be resisting contemporary science and medicine. Yet the very rationale that they used to support their arguments for breastfeeding grew out of contemporary scientific advice and research. They were not so much dismissing the importance of science and medicine as insisting that doctors listen to their interpretation of the research. The image of the League as a group of women insisting on their knowledge, maternal instincts about the best childcare practices, and railing against a disinterested and outright hostile medical profession. Viewed from one perspective, these women were promoting women's knowledge against the dictates of the masculine, highly scientific medical system. Yet, it is most critical to remember that the League was not rejecting medical knowledge. True, they didn't believe that doctors were necessarily the best sources of this advice on infant feeding. They did elevate the role of the nursing mother. Yet from the very outset of the organization, and still today, they remind the public and their members that doctors considered breast best. The League justified its stance both with traditional arguments for maternal nursing and with medical arguments drawn from contemporary scientific literature, actively soliciting support of physicians who promoted breastfeeding, scientific motherhood shaped by physicians and mothers. In the past 4 decades, a still greater challenge to the authoritarian medical profession has arisen with the publication of Our Bodies, Ourselves, first published in the United States in the early 1970s. And since then, it's been translated and adapted for a wide range of situations, from English language editions for Britain, South Africa, and India, as well as editions in Chinese, Hebrew, Japanese, Russian, and Arabic, and Tibetan, and other languages. The genesis of such publications often comes from women's desire to learn more about their bodies and their health. While they do not dismiss medical knowledge, they do warn against the mystique of professionalism, in which the true nature and importance of professionals' knowledge and skill become inflated, so that they are seen as more powerful, more expert, more broadly knowledgeable than they either are or should be. In other words, authors of such publications value contemporary medical knowledge, but they insist on readjusting the balance between the medical provider and the patient. They recognize the validity and the significance of their own experiences based on cross-class and race histories and struggles. Yet, this did not lead them to repudiate science and medicine. They did, however, reject the idea of an authoritative practitioner and insisted that women were capable of evaluating this information for themselves. They pushed for a more equal partnership between medical practitioners and patients. Partnership is the ideal form of scientific motherhood, which benefits from the knowledge and expertise of both the practitioner and the patient, both the physician and the mother. It is just that, an ideal. Just as the earlier forms of scientific motherhood were ideals, never universally attained, partnership is a goal. Women are very aware of the significance of their child care activities. They look to experts because they want to fulfill the job given to them, and this quest for knowledge reshapes the collective and individual acts of scientific motherhood. Today, modern motherhood is tightly intertwined with medicine, but it is a medical practice that is slowly changing. where mothers have the education, the finances, and the time to insist on their involvement, healthcare providers talk more often of a collaborative partnership. Such cooperation between mothers and experts isn't easy to attain. It requires respect for the knowledge of the scientific and medical experts and for the knowledge of mothers. In many parts of the world, women and children continue to struggle with patriarchal authority, with an unresponsive state, with insufficient health care, living in geographically isolated areas, or lacking financial resources or the time to visit practitioners or clinics. Where the health care is accessible, it often aims to process patients as efficiently as possible, leaving little time for significant discussion between healthcare providers and mothers. Pressures on mothers make it difficult, if not impossible, for them to find the time to acquire and digest the information they need from a confusing array of contemporary sources. Mothers and other child care providers and practitioners need a supportive social and cultural network that will enable them to learn from each other. We need to establish flexible healthcare systems that acknowledge the reality of mothers' situations, that are capable of responding to the diverse needs and realities of women's experiences. Most critically, we need to go beyond our healthcare system and admit that it is an entire society's responsibility for child welfare. Such efforts will take time and money and education as we prepare providers and patients with the tools they need to build, rebuild, expand, and defend a healthcare system that is truly responsible to all mothers. Thank you.